Picture this. A peaceful walk in the park, sunlight streaming through the trees, the gentle sound of birds in the background, and a sense of calm all around. For many seniors, moments like these are cherished, representing health, happiness, and the freedom to enjoy life's simple pleasures. Imagine a senior couple enjoying their day, sharing laughter and conversation as they stroll together, seemingly without a care in the world. But behind the scenes, there are hidden risks that often go unnoticed. Risks that may be sitting quietly in the medicine cabinets of millions of older adults. Those familiar bottles of over-the-counter pain relievers might seem harmless, part of a daily routine for aches and pains. But for seniors, these medications can sometimes do more harm than good, especially when used every day. Today we're diving into a crucial topic: 10 pain relievers that seniors should avoid using daily, especially as we approach the year 2026 when new health guidelines and research are coming into focus. These medications are easy to reach for when joint pain flares up or a sore back makes daily activities difficult, but for people over 65, taking these drugs every day can lead to serious and sometimes life-threatening complications. We're talking about risks like stomach bleeding, kidney damage, liver failure, heart issues, dangerous falls, and even confusion or memory problems. These side effects can sneak up on you, making it even more important to stay informed. Always talk to your doctor before stopping or changing any medication. This video is for education only. Let's explore which pain relievers to watch out for and how you can protect your health as you age. Let's get into it. Let's kick things off by talking about ibuprofen, a medication that's found in almost every household medicine cabinet. You might recognize it by popular brand names like Advil and Motrin, which are often reached for when pain or inflammation strikes. But for seniors, especially those over 65, taking ibuprofen every day can quickly become dangerous. This common painkiller significantly increases the risk of developing stomach ulcers and gastrointestinal bleeding, which can be life-threatening if not caught early. Ibuprofen doesn't just affect your stomach, it can also raise your blood pressure and put extra stress on your kidneys. If you already have heart problems or take blood thinners, these risks multiply, making ibuprofen a much riskier choice than many realize. What's even more concerning is that kidney damage from ibuprofen can sneak up on you, often showing no symptoms until the damage is already severe and sometimes irreversible. Chronic or high-dose use of ibuprofen can even increase your risk of having a heart attack or stroke, especially if you have other underlying health conditions. That's why the best advice is to use ibuprofen only when absolutely necessary, and never make it a daily habit without your doctor's guidance. Instead, talk to your doctor about safer alternatives. Sometimes, a topical gel, physical therapy, or other non-drug treatments can provide relief without the same risks. The bottom line is this: if you're a senior, ibuprofen should never be your go-to solution for daily pain. Always weigh the risks and explore safer options first. Next up is naproxen, sold as Aleve. Like ibuprofen, it's an NSAID with similar risks: stomach bleeding, ulcers, and kidney strain, especially in those over 75. Naproxen can also cause fluid retention, dangerous for people with heart failure or hypertension. NSAIDs can raise blood pressure, adding yet another risk. The American Geriatric Society cautions against routine NSAID use in older adults for anything more than short-term relief. For seniors, the risks of daily naproxen use usually outweigh the benefits. Always talk to your doctor before using it beyond the occasional dose. Many people think of aspirin as a safe old-school option. While low-dose aspirin for heart protection can be recommended, high-dose aspirin or daily use for pain is risky for older adults. Aspirin increases the risk of stomach ulcers, gastrointestinal bleeding, and even brain bleeds, especially if you're on blood thinners. Seniors process drugs more slowly, so effects can linger and accumulate. The American Geriatric Society now recommends avoiding daily high-dose aspirin for pain in older adults. Talk to your provider before using aspirin as a regular pain reliever. If you're taking it for heart protection, make sure your doctor is monitoring your labs and symptoms. Indomethacin or Indocin is a prescription NSAID sometimes given for arthritis or gout. It lands on almost every avoid list for seniors due to high risks of GI bleeding, confusion, and kidney toxicity. Indomethacin can cause ulcers that may bleed without warning and has been linked to episodes of confusion and delirium. The longer half-life means it sticks around in your system, increasing toxicity risk. doctors now often avoid prescribing these drugs for long-term use in people over 65. If you or a loved one is taking indomethacin daily, talk to your healthcare provider about alternatives. There are safer ways to manage chronic pain that won't put your organs or brain at risk. Acetaminophen, commonly known by the brand name Tylenol, is often considered a safer, gentler alternative to non-steroidal anti-inflammatory drugs, or NSAIDs, especially for pain relief in older adults. Many people reach for it without a second thought, trusting its reputation for being mild and easy on the stomach. But taking high daily doses, or using acetaminophen for long periods, can actually lead to serious health problems, risks that are often underestimated or overlooked, particularly by seniors who may already be managing other health conditions. The most well-known danger is liver damage. Even a small amount over the recommended daily limit can cause harm, and in severe cases, liver failure can be life-threatening or even fatal. The liver is responsible for breaking down acetaminophen, and it can be overwhelmed if you take too much. Chronic high-dose acetaminophen use doesn't just threaten the liver, it can also contribute to gastrointestinal bleeding, kidney failure, and even raise your blood pressure over time, complications that can be especially dangerous for older adults. Seniors are more vulnerable to these side effects because their liver and kidneys may already be less efficient due to age or other medical conditions, making it harder for their bodies to process medications safely. It's surprisingly easy to exceed the safe daily limit without realizing it, especially since acetaminophen is found in many combination cold, flu, and pain medications. Always check labels carefully to avoid accidental overdose. To stay safe, stick to the lowest effective dose for the shortest possible time. And never use acetaminophen as a daily fix unless your doctor specifically recommends it. Regular use should always be discussed with a healthcare provider. If you find yourself relying on acetaminophen every day, it's a sign to schedule a medication review with your doctor or pharmacist. There may be safer, more effective options for managing your pain or symptoms. Mepridine, also known as Demerol, is an opioid pain medication that was once commonly prescribed. Today, it's on the avoid list for older adults due to high risk of confusion, delirium, and even seizures. This medication breaks down into a toxic substance that can build up quickly, especially in people with reduced kidney function. Even short-term use has been associated with sudden confusion, hallucinations, and falls. Because safer alternatives exist, meperidine is now rarely recommended for chronic or daily pain. If you come across this medication on your prescription list, talk to your healthcare provider. There are much safer ways to manage pain that won't put your brain or safety on the line. Codeine is another opioid that often sneaks into combination painkillers or cough medicines. While it can be effective for short-term pain, daily use in seniors is definitely a no-go. Codeine can cause severe constipation, respiratory depression, confusion, and falls. Older adults metabolize codeine differently, making its effects unpredictable and sometimes dangerous. Even a mild overdose can lead to a fall, a broken bone, or a head injury. Most guidelines recommend skipping codeine, especially for daily use. If you see codeine on your medication list, check with your doctor about alternatives. There are better, safer ways to manage pain in older adults. Tramadol, or Ultram, is sometimes prescribed as a safer opioid for chronic pain in older adults, but it's far from risk-free. Tramadol comes with unique dangers for seniors, including serotonin syndrome, seizures, and falls. The risk of serotonin syndrome goes up if you're on certain antidepressants, very common in older adults. Seizures are another major risk, especially at higher doses or with other medications. Like other opioids, Tramadol can cause drowsiness and dizziness, leading to dangerous falls. Daily or long-term use of Tramadol is generally not recommended in seniors. There may be non-opioid options that are much safer for daily pain. Some prescription painkillers combine opioids like oxycodone or hydrocodone with acetaminophen or NSAIDs, think Percocet and Vicodin. These combos double up on risks, opioid side effects plus liver toxicity or bleeding and kidney risks. Many people don't realize how easy it is to accidentally overdose on acetaminophen or NSAIDs in combination pills. Seniors are more susceptible to each of these risks, and when you stack them together, the dangers multiply. These combos should almost never be used for daily long-term pain management in older adults. If you're prescribed a combination opioid, ask your doctor if there's a safer plan. Consider separating medications, lowering doses, or switching to topical or non-opioid alternatives. Last but not least, muscle relaxants like cyclobenzaprine, methocarbamol, and carisoprodol. These drugs are often prescribed for back pain or muscle spasms, but for seniors, they can cause more harm than good. The biggest risk is heavy sedation, which increases the chance of falls. Muscle relaxants can also cause confusion, dry mouth, constipation, and problems with urination. These anticholinergic effects can worsen memory problems or trigger delirium in seniors. Most guidelines now recommend avoiding muscle relaxants in anyone over 65, especially for ongoing pain. Safer options, like gentle stretching, physical therapy, or topical treatments, can often work just as well. There you have it. 10 pain relievers seniors should really think twice about using daily. The big takeaway? NSAIDs like ibuprofen and naproxen top the danger list for bleeding and organs, while even safe acetaminophen has limits, and opioids add fall and confusion risks. Safer options often include topical creams, physical therapy, and low-impact exercise. Always check with your healthcare provider for the best plan.